Good evening to all in the Nursing 132 course. The purpose of this presentation is to discuss how the ISBAR approach to handover aligns to communicating for safety national standards that govern acute and aged care. Throughout my presentation, the objectives that I will be speaking about include introducing a structured communication tool which is ISBAR and how it is used, explain how to inflict verbal and non-verbal communication strategies, and lastly, if cultural sensitivity and safety aid in effective communication with Aboriginal and Torres Strait Islander people and other multicultural communities. In a hospital setting, most of the communication related to patient care is achieved by a concise transfer of a patient's clinical information from one healthcare provider to another during handoff. During this time, different communication styles between nurses and physicians are one of the contributing factors to communication errors. Ineffective communication or failure to document relevant information in a structured clinical handover compromises precious time and leads to medical errors and legal implications. In this case, a structured communication tool would be beneficial. ISBAR is a tool that is reliable and provides safe patient care. Now, how does ISBAR work exactly? By simply following the communication structure as so, in any anticipated healthcare personnel to achieve person-centered care. The image below illustrates the standards for effective communication for safety. The ISBAR framework consists of 5 elements focused on communication. This approach has several advantages such as ensuring competence of information and reducing the likelihood of missed data while taking care of aged and acute people. Ineffective communication can lead to delays in treatment and contribute to negative patient outcomes and experiences. To achieve an effective ISBAR handover, it is important to have a clear understanding of information. This is particularly vital when critical situations arise in healthcare. Multiple innovative researchers have said using ISBAR communication structure has proven through many studies to have shown a reduction in adverse events in hospital settings, improvements in communication among healthcare providers, and promotion of patient safety. An independent nursing research team has published a scientific article in 2017 highlighting their success in obtaining a quicker overview in a patient situation and improving student nurses' confidence in their own communication and expertise, resulting in better teamwork in hospital units. Errors in healthcare in Australia are most often attributed to failure to communicate. 4 out of every 100 individuals who have planned admission in hospital are exposed to an error in care. For those who have unplanned admission, the incidence of errors doubles to almost 10 out of 100 individuals. Nurses play a key role in minimizing these errors and ensuring that healthcare provision is safe. While performing ISBAR, nurses inflict verbal and non-verbal strategies to communicate effectively in order to come across with clear interpretations towards the patient. Communicating for safety is a key element in standards for aged and acute healthcare provisions. These standards govern the way that healthcare is provided. An organization will only be permitted to provide care when it meets these standards. As these registered nurses working in healthcare, there is an expectation that your practice will align and adhere to these standards. National Safety and Quality Health Service Standard 6 for communicating for safety involves the accurate and careful exchange of information about a person's care between treating patients. This standard aligns with the handover tool as the communication skills of a health profession involves introducing themselves, introducing their client, and using effective verbal and non-verbal communication skills. Emphasizing tone and choice of words to express certain emotions for others to read are examples of this. The listener decodes these, resulting in a receipt of intended and unintended messages. Whilst non-verbal communication can involve eye contact to focus on the patient-centered care. In interactions, you can read a patient and interpret what is said and what is meant to be said, in conjunction with body language and other non-verbal signs. It is important to understand body language and use it to aid communication to avoid unconscious messages, and to also decode and react appropriately to other people's visual cues. Giving personal space and showing facial expressions are also other examples that are effective in communication. However, addressing older patients can be slightly different to talking to other adult-age patients. It is common for many older adults to have a fear of creating fuss and along with a higher chance of memory and cognitive disturbances. This can create an enormous potential for missed care. When treating a patient in aged care, effective communication is a must in order to meet the requirements for Standard 1 consumer dignity and choice. And to stress even more, Standard 1 supports all the other quality standards and is essential to provide consumer-centered care. The ISBAR approach to handover aligns with most of the safety national standards for aged care. An example is Standard 3 Personal Care and Clinical Care Requirement Part E, which states information about the consumer conditions, needs, and preferences should be documented and communicated within the organization and with others where responsibility for care is shared. This standard aligns with structural clinical handover, which is a common term among nurses and medical students. It involves core steps in a patient's journey, and it is a requirement that should be taught to all health professional students and juniors. When the core steps are followed well, clinical handover ensures that the lapse in continuity of a patient's care, errors, and harm are reduced in a hospital or community setting. A well-structured framework for handover, such as ISBAR, improves patient outcomes. This framework was endorsed by the World Health Organization since it provides a standardized approach for communication which is available in any situation. In complex clinical settings, this approach works best well when all have the same training of the approach. Healthcare leaders should ensure that the parties are trained and that good clinical handover approaches are developed and maintained. Looking at what each word at ISBAR entails, it is real that each step has something to offer to ensure effective communication for better of acute and aged patients. A research publication article that investigated ways to improve emergency departments in an aged care medical clinical handover began with auditing the process and surveying doctors before and after an intervention regarding their practice and preferences. When the ISBAR structure was implemented and supported in the healthcare staff members, it led to greater confidence in their own assessment and analysis. An increase in mastery was prominent in their findings and to more professional discussions, which resulted in agreements on treatment strategies. Most of the professionals also found that the ISBAR encouraged good teamwork and ensured patient safety in nursing. This concluded that the bedside handover using ISBAR resulted in an improved patient involvement, communication, and non-significant trend to improve patient safety. Each patient has social, cultural, religious, spiritual, and medical needs that affect the care service and support they need. So incorporating verbal, nonverbal, and effective person-centered care documentation that references the person rather than the condition only makes healthcare providers' handover more accurate and clear to interpret by other healthcare team members. It also ensures patient does not go into harm. Using these strategies to support the patient in aged or acute care helps them feel confident sharing their identity and helps the workforce to see them as a whole person. An article written by a professor from ACU has highlighted demonstrating cultural empathy by seeking to understand the person's cultural and spiritual values and avoiding generalization and stereotypes when discussing people from different cultural groups. When communicating with individuals that speak a different language, it is important to demonstrate empathy, respect, and attempt to establish a rapid relationship. Cultural safety is about creating an environment that is safe for Aboriginal and Torres Strait Islander people. This means there is no assault, challenge, or denial of their identity and experience. Healthcare professionals must demonstrate a willingness to build an understanding of the person's perspective, experience, and need in order to provide meaningful support and care. Through this demonstration of empathy, individuals are encouraged to engage in their care. Non-verbal communication is just as important, sometimes more so than verbal communication. It is important to understand non-verbal cues from the perspective of Aboriginal people. In Aboriginal culture, averting eye contact during communication is a sign of respect, and silence during conversations are considered the norm and are valued, showing conciseness. The perspective, the positive use of silence should not be misinterpreted as a lack of understanding, agreement, or urgent concerns. Practical knowledge of these issues will aid effective, safe, and appropriate clinical communication. Use of these sensitivities can also result in effective communication that governs and fulfills the requirements for all national standards of safety. Performing these standards and strategies enables therapeutic interpersonal relationships, which are primary components of all healthcare interactions, that facilitate the development of positive nurse-patient experiences. Proper documentation using ISBAR structure builds for an allowance for successful clinical handover to take place. Thank you so much for listening to my presentation discussion. Have a nice day.